Trump was slow to address the spread of the disease, initially dismissing the threat and ignoring persistent public health warnings and calls for action from health officials within his administration and Secretary Azar. Throughout January and February, he focused on economic and political considerations of the outbreak and largely ignored the danger. By mid-March, most global financial markets had severely contracted in response to the emerging pandemic. On March 6, Trump signed the Coronavirus Preparedness and Response Supplemental Appropriations Act into law, which provided $8.3 billion in emergency funding for federal agencies. On March 11, the World Health Organization (WHO) recognized the spread of COVID-19 as a pandemic, and Trump announced partial travel restrictions for most of Europe, effective March 13. That same day, he gave his first serious assessment of the virus in a nationwide Oval Office address, calling the outbreak horrible, but a temporary moment, and saying there was no financial crisis. On March 13, he declared a national emergency, freeing up federal resources. Trump falsely claimed that anybody that wants a test can get a test, despite the availability of tests being severely limited. In September 2019, the Trump administration terminated United States Agency for International Development (USAID) program, a $200 million epidemiological research program initiated in 2009 to provide early warning of pandemics abroad. The program trained scientists in 60 foreign laboratories to detect and respond to viruses that have the potential to cause pandemics. One such laboratory was the Wuhan lab that first identified the virus that causes COVID-19. After revival in April 2020, the program was given 2 6-month extensions to help fight COVID-19 in the U.S. and other countries. On April 22, Trump signed an executive order restricting some forms of immigration to the United States. In late spring and early summer, with infections and death counts continuing to rise, he adopted a strategy of blaming the states for the growing pandemic, rather than accepting that his initial assessments of the course of the pandemic were overly optimistic or his failure to provide presidential leadership.